our series, we will take a topic of endometriosis because it's really a very big dilemma for our patient with regards to the definition. They don't know what is endometriosis. When you tell the patient of the laparoscopic procedure or after any scanning to diagnose any endometrioma, even giving the explanation to the patient, sometimes they are not even aware what is endometriosis. So today we'll discuss what is actually endometriosis, what are the symptoms of the endometriosis, how do you diagnose endometriosis, and also how do you treat endometriosis. And as you know, by the grace of God, we are a pioneer researcher in this basically in the country and also in the world. You can see all our research work on endometriosis, which our center in whenever the PhD students and the researchers they were with us, we have been doing active research on endometriosis. So endometriosis definition is implantation of endometrial gland outside the uterine womb, in the pelvis or in the tube or in the ovary. In ovary, when there is an endometriosis, it is called endometrioma or chocolate cyst. And if it is basically, it penetrates inside the myometrium, it is called adenomyosis, endometriosis interna. Or whenever it is getting implanted in the ovarian fossa or in the pelvis, it is called endometriosis externa. You must remember the main problem with these patients with endometriosis is pain. Because there are secondary involvement of immunological factors, cytokines, interleukin, macrophages, and prostaglandins imbalance, which is causing a lot of pain. Pain continuously in the lower part of abdomen. Second problem, they will have severe dysmenorrhea, which they do not get relief with any painkiller. Thirdly, they will have dyspareunia, pain when they meet their husband. And the fourth and very resistant problem of infertility they have. Infertility, the reason why they have infertile, as I told you, because of this implantation of endometrial gland outside the uterine womb. So lots of problem with the elevation level of the immunological factor, macrophages, cytokines, prostaglandins are there. So these patients where they have infertility, so basically they will have resistant case of the infertility, which does not give response easily to conventional treatment like ovulation induction or IUI. And most of the time they should go for in vitro fertilization and ICSI. Especially a staging, if you go after the stage 1, stage 2, which is considered to be the mild endometriosis, stage 3 and 4, which is the involvement of the tube, obliteration of pouch of Douglas, which it is been only diagnosed based on the ultrasound. And they will go this category of severe endometriosis, they have to go for in vitro fertilization and higher grade of the ART treatment, sometimes third party involvement because the quality of egg also not good, or maybe they need to go also for surrogacy if the uterus is also being destroyed and is also not giving any response to the normal embryo implantation, and it is causing a lot of abortion in this patient. Why the question is come to your mind, why there is infertility, why this patient with endometriosis they have resistant cases of the infertility which they do not respond. The reason is the cytokines and the macrophages and the prostaglandin which is involved in these sites which is endometriosis are there, the implants. It will prevent the fertilization of the sperm and the egg. This is one. So fertilization will be blocked. Then once the embryo develops, because of the quality of the egg in patient with the endometrioma, quality of the egg is also very poor, not so successful. So fertilization will be problem. Then there will be a division of embryo problem, early embryonic development problem, abortion will be a problem. So at all level of this reproductive process, the meeting of sperm with egg, the implantation, the division of embryo, the embryonic development, the implantation, in every aspect they have problem. Even if we get a successful embryo or blastocyst, but then once it gets implanted, they may get aborted. So the question comes to your mind, is it treatable? Can be patient in spite of having a severe endometriosis, stage 4, stage 3, can they get a successful pregnancy with their own sperm and their own egg? The answer is yes. If they come when they are young, if they come in a very chronic stage after 15 years of marriage, after being in a stage 3 endometriosis, a stage 4 endometriosis, success will be compromised. So then it is better as an expert, any doctor who is treating these patients with endometriosis, to refer them early for ART. And patients, they should also be aware that yes, I need a higher grade treatment. I should go for a better treatment, more higher grade to get the success. And age after 36 with a stage 3 or 4 endometriosis, it will cause problem. Then we will have no success. But if they are younger, definitely we can overcome these problems which I mentioned to you. And if at all they come in old age, then maybe sometime we have to consider surrogacy. So now the diagnosis come. There are scanning, TBS, where it can diagnose chocolate cyst, endometrioma, and the size we can know, and the basically is MRI, where it will diagnose adhesions. Diagnose means there is a suspicion of this adhesion and the distorted anatomy, where the usual place where we see the ovaries or the uterus we may not be able to see. As an expert, we can easily see the adhesion, the presence. So we said TBS, we said MRI, but the gold standard way of diagnosing endometriosis is by laparoscopy. By laparoscopy, when we do, it's basically not only we diagnose the implant, the golden color, the blue, purple, bluish, and reddish color implant, where we see the implantation. Of course, the diagnosis also at times we have to do by biopsy. The biopsy and send it for the histopathology to see the endometrial gland. And we can also do the staging as per the ASRM, stage 1, stage 2, stage 3, stage 4. And the grading and the scoring should be given, which will be given from 5 to 40. And 40 above, which will be the severe, like obliteration of the pouch of Douglas, involvement of both the ovaries and the tubes. In about 50% of patients, you must remember endometriosis is associated with a PID, pelvic inflammatory disease. Because the etiology of endometriosis in our Indian ethnic group of patients, which is about 30%, 30 to 40%, it is because of IFN gene, the adhesion molecule in our Indian patients. So that molecule is also involved in patients with TB. So this TB, tuberculosis, PID, and endometriosis may be associated together. So when we are saying sometimes in endometriosis tubes are blocked, is because of association with the PID. That's the thing. So diagnosis we said by TBS, then MRI, then by laparoscopy. And the treatment is a surgical and a medical. Surgical is by doing a laparoscopy and adhesiolysis and dealing with the endometrioma. But dealing with the endometrioma, again, the question of the AMH, anti-Mullerian hormone, where the ovarian reserve will decrease. That's something we have to be very cautious when we are dealing with the ovarian endometrioma, and we have to explain all these things to the patient before taking care of. And the last is the ART, if they are also coming to you and to us for the infertility treatment. In patients with a mild endometriosis 2-3 cycle, IUI is sufficient. If they don't respond, then refer them for the ART, IVF. And patients who are having the medical therapy, there are oral preparation damages we give to 2FG for about 3 to 6 months if they are not having any infertility problem, or if only pain is the major problem or major factor. But if there are infertility issues, then it's better you give them LHRH agonist post laparoscopy or pre-laparoscopy. And it's always better if they are having infertility problem, you do this laparoscopy along with LHRH agonist and LHRH depot before doing the ART, so that the response comes in a very optimized manner. So to conclude with, the incidence of endometriosis is on rise. The answer is yes, because of the pollution. There are also pesticide factor and endocrine disruptors are involved in increasing the etiology of the endometriosis. And second factor is also late marriage, because the major factor in causing endometriosis is a high level of estrogen, hyperestrogenic state, where the more you delay your marriage, the more estrogen get piled up in your body. Not only incidence of breast cancer, but incidence of fibroid, endometriosis is increasing more. And the better is early marriage. If you are not able to do, at least if you get married, take an early treatment and early expert opinion and embark on pregnancy as soon as possible. And it is also an important message I would like to give to all our audience who are following our videos, that please contact us at the earliest on 984916141. And we are not connected to any other agency like Practo or anything else. Please contact us directly and you will get success as soon as possible.